Was whether antibiotics should be restricted or not. According to Webster Dictionary, an antibiotic is a drug that is used to kill harmful bacteria and cure infections. When antibiotics were first discovered, people called them wonder drugs because they cured illnesses that cause death. They have made diseases like pneumonia much less of a threat than they were a century ago. Search for antibiotics began in the 1800s with the growing acceptance of the germ theory. Scientists wanted to find something to kill bacteria that caused infections and deaths. Penicillin was invented by Howard Florey and Ernest Chain in 1941. Antibiotics were first used in the 1940s by a doctor at the Oxford Hospital. A patient had a wound that was infected by bacteria and it was deadly. But when the doctor used penicillin, the wound made a recovery. Okay, how antibiotics work. They have been made so that they only kill the bacteria that causes the infection, and they leave the normal cells in the body alone. An antibiotic might inhibit a bacterium's ability to turn glucose into energy, or its ability to construct a cell wall, as well as it stops the bacteria from multiplying and spreading. Antibiotics shouldn't be restricted because they help fight deadly diseases and they help regulate the body system. They help fight deadly diseases such as high blood pressure. I'm sure everybody here knows somebody with high blood pressure and that need medication because without it they'd be at higher risk for like stroke and heart attack. Ear infections are also something that require treatment because they can't get better on their own. And strep throat also does because if it's not treated, it can lead to other parts of the body as well. Between the years 1940 and 1960, the death rates due to infectious diseases has declined. This was due to penicillin, many people believed, and other antibiotics. As well, the mortality rate had decreased 67% from the years 1900 to 1980. By 1960, 70% of infants were expected to live to the age of 65, which was a longer life expectancy than before. Infectious diseases were the leading cause of death in 1900. Thus, people were dying from pneumonia because they now had treatment to help get them better. And then here's a graph that shows from 1990 to 1980, and this is the mortality rates due to infections. And for the most part, it decreased. So basically, antibiotics have come a long way throughout the years and can now kill a lot more diseases as well. And they're designed to stop bacteria from spreading, and they cure illnesses. And without them, many more people would be dying each year like they used to, and the good of the antibiotics definitely outweigh the bad.
Antibiotics were first discovered by an accident by Alexander Fleming. They were first prescribed in the late 1930s. The antibiotics jumped life expectancies up by 8 years. Antibiotics are a substance such as penicillin or streptomycin produced or derived from certain fungi, bacteria, and other organisms. They can destroy and inhibit growth of other microorganisms. Antibiotics are widely used in the prevention and treatment of infectious diseases. Antibiotics are used for treatment or prevention of bacterial infection, and they're also used for food for livestock. Antibiotics should be restricted because of overusing, and antibiotics do not cure. They aren't able to cure certain viruses. The impact of antibiotic resistance is increased rates of treatment failure, poor patient outcomes, increased mortality, increased need for combination therapy, and increased costs for treatment. Effects of overusing are you may not be able to overcome the resistance. Constant fight against antibiotics teaches the bacteria to grow even stronger. If the antibiotics aren't the right type for your condition, it won't kill the bacteria and make the bacteria become stronger. They kill healthy gut bacteria that are essential for the body, keep your immune system healthy. Heavy use can cause breast cancer. They destroy your immune system slowly. They can cause diarrhea as an effect. They can also cause colon disease, fatal skin rashes called Stevens-Johnson syndrome, allergy-like symptoms such as wheezing, and difficulty breathing. Severe cases can cause breathing to stop altogether. The use of antibiotics for viruses will not treat or cure some types of viruses. Common viruses that aren't cured by antibiotics are bronchitis, colds, flu, most coughs, ear infections, sore throats, and the stomach flu. This is the unnecessary antibiotic prescriptions these are all viruses, and it shows that antibiotics shouldn't be used for ear infections. 30% of the prescriptions were unnecessary, and some of them aren't necessary, and millions of prescriptions that were applied that aren't necessary, causing overusing them. And antibiotics that concludes that antibiotics should be used if done necessary, for not overused or not for viruses, because they're unnecessary for them. And that is it.
Hey, whoa, you're not out of, what'd you got?